Awesome. All right. So numbers in Colorado. Unfortunately, we are seeing our Thanksgiving surge. So you can see the cases are higher than they have been certainly over the summer. But the Thanksgiving surge is beginning to hit us. If you look at our positivity rate here, it is about where it was, interestingly enough, after Halloween. So I think that, our holidays are what does us in here in the United States. The week cumulative incident rate is essentially, what it was before for Lake County, and certainly for the remainder of Colorado. The incident rate is very high, over 100 cases per 100,000 people. And again, remember, this is as if Lake County would have 100,000 people. It's adjusted based upon our population, but the darker the color, the more cases per population we have. Hospitalization rates, again, are huge. And if you look at this third surge here in Colorado, it is much higher than the surge that we had, even back in the spring. So our hospitals are straining under the weight of COVID this week as last week. Deaths, unfortunately, also follow where we're growing, and we had, the enormous surge of deaths initially in the spring. And then even now with our treatments that we have for COVID, unfortunately, more people are dying as our numbers increase. We didn't really see an increase in deaths during the summer surge, but because this surge is so huge compared to where we've been before, the death rate is also unfortunately very high. Our local data, we continue to follow what the state does. We are having an extraordinarily number of cases. And if you look, for example, over the summer, we would have 3 to 4 cases a week. We are now having, 3, 4, 5 cases per day in our institutions. And if you look here, there were even a couple days where we had more than 10 cases per day that came through both Rocky Mountain Family Practice and St. Vincent Hospital. So the Thanksgiving surge has hit us as well, and unfortunately, that's not going to get better for a couple weeks until those small family gatherings are what what are getting us. Our positivity rate continues to climb, as does Colorado's. If you look at our graph, the number of cases that we're having, per week, again, are just huge. And if you look at the number of people who are coming in who are getting tested, although there are more folks who are getting tested, more of them are positive. Our total numbers, just, continues to skyrocket. And then hospitalizations are following suit as well. If you look at the local hospitalizations here at St. Vincent's, you can see that we are having more and more COVID patients admitted to our ward, which makes sense. The more COVID patients we have in our community, the more we're going to admit. This is just the COVID patients. And so it's important to remember that we still have other patients that we admit as well. And so our current census here at St. Vincent's is 3. We have a 5-bed capacity. The positivity rate data that comes through, 282 positive cases that have been tested in Lake County. If you look at the state's data, you'll see that this number is now well over 300. And you remember there are others, who seek medical care outside of our community. And there's about 50 plus more people who have, although live in Lake County, have been tested outside of Lake County. So this number for us is just the people who have come through Rocky Mountain Family Practice or St. Vincent's Hospital. The overall positivity rate, if you remember all through the summer, it was about 5%. Now it's up to 9%. And if you look over the past 2 weeks, we have a 22% positivity rate, folks. 68 people have tested positive in Lake County in the past 2 weeks. That is the biggest number we have seen yet. It's huge. And the denominator, we're testing lots of people, so it's not as though this number is artificially elevated. It is a true number of how many people are positive. And then the positivity rate in Colorado is much less, overall than we are here. Again, my favorite slide still gets to be my favorite slide. There are no deaths that have been reported out of Lake County yet, and hopefully that remains the same. We have learned through this pandemic that spread happens in the home, small family gatherings. It is not happening in our restaurants. It is not happening in our medical facilities. It is not happening in our schools, other retail merchants. Everyone in the business sector is doing such an amazing job covering their faces, limiting how many people, walk into their buildings, washing their hands. Their employees are staying home when they're sick. So as we've learned as a nation, this happens in small family gatherings. When you let your guard down, you take off your mask and you walk into somebody's house. So please, make sure that you're doing your best to avoid those situations where we know that people are getting infected. Good news, vaccines are beginning to roll out here in the United States. We're waiting for the FDA to approve them, which should happen just any day now. We're meeting with the Public Health Department today to talk about how we're going to roll out our initial phase of vaccinations for healthcare workers and first responders. And then, the subsequent vaccinations will happen for those at high risk and then for the rest of us. But that's the good news on the horizon, but it is on the horizon. It's not here today. So please continue to be diligent in your work at containing what's happening with COVID. Are there any questions for me?
Do you have any good news?
Yeah, the vaccine is coming, and the vaccine is great.
Oh, okay, all right.
There was a news that came out today that looked at some side effects that the people in England were experiencing, and there were two allergic reactions that happened to folks who have had allergic reactions to vaccines before. They were not the serious one. There was not an anaphylactic reaction, but they did have, some local allergy. And so, again, not surprising. Certainly when you start vaccinating hordes of people, there will be some allergic reactions. And so I imagine that the FDA will take a look at that information today and then guide us, as healthcare workers about how we're going to vaccinate our folks, and that people who have a true allergy to a vaccine, and it's not, I got a vaccine and the vaccine made me feel a little sick. That's supposed to happen. That's what vaccines do. But these are true allergies where you have closing of your throat, swelling of your tongue, difficulty breathing, that we will probably know not to give vaccines, obviously, to those folks. But yes, the vaccine is coming, and it is the end of the pandemic. And I'm going to take my little dog and pony show here out over the next several months to folks to, teach everyone how the vaccine was made, how it was developed, how it works, and why it's safe. Because information is power, and really understanding how something is manufactured, I think, and all the safety information will make us all feel better about taking the vaccine.